No matter how you feel about going to the dentist, you might dread it, might even put it off. We all know how important it is to your health. Well, we learned today that more than 5 million New Yorkers on Medicaid will soon have dental coverage to get needed root canals, implants, replacement dentures. Specifically, we're talking about 340,000 people just in our 8 counties. Now, this is a result of a class action settlement. Medicaid programs vary across the country and they are not required to cover dental. But if a state offers optional care, it has to include everything that's deemed medically necessary. And that is what is changing here in New York. If it's medically necessary, it will be covered. Joining us now is Belkis Garcia. She is a staff attorney with the Legal Aid Society, the group that filed this lawsuit. Really appreciate you taking some time for us here. And we mentioned how this is going to have a significant impact on millions of New Yorkers, a lot of them right here in the western part of the state. I wonder if you could just start here by walking us through how this settlement came to be and what specific dental services are now going to be available to these adult Medicaid patients.
Yeah, absolutely. Thank you so much for having me and for your interest in this. It's a big change. This case was filed in 2018 to challenge the Medicaid coverage rules for certain dental services. You had asked how it came to be. I have represented Medicaid recipients in New York City for many years, and quite frequently, people are seeking Medicaid coverage of what you might think of as like a very basic dental service, and unfortunately, the advice for until soon has been that unfortunately the Medicaid program does not provide coverage for root canals or crowns if you're over 21 years old. Our real only option was to file a lawsuit to change those rules. Which we did in 2018, but the rules themselves have been essentially the same since the beginning of the Medicaid program. It really had been stuck in like the 50s.
A lot of people think of dental coverage with someone's physical health. It can go even beyond that. You were quoted in the New York Times today saying you need to have teeth to function in our society. Can you talk bigger picture about what this change means for people even beyond just their health and why this change is so important, you believe?
Yeah, absolutely. I mean, it is critically important to people's physical health. That is true as well. Oral health is really interconnected to people's overall well-being, and that's their physical health, but also people's mental health and their ability to be out in the world. I have had so many clients and spoken to so many people who are deeply isolated and depressed because of the state of their oral health, because of the state of their teeth. They're not able to leave their homes. They feel that they can't socialize. People have talked to me about missing family reunions. It also impacts people's employability, their ability to get jobs, and really just to be comfortable in their own skin and to walk around in the world and interact with people. You know, I hear really frequently from people who feel very aware of how they're being perceived and what the world thinks of them because they, for example, don't have teeth.
I'm almost out of time, but quickly here, if I can end with the cost of this. Obviously, there will be an added cost on the state to cover this. There have already been some people who have commented on the story saying, you know, Medicare patients don't get dental coverage. What would you say to those who sort of criticize that discrepancy, that now Medicaid patients will have this access, whereas Medicare patients won't?
I mean, I think that New Yorkers should be proud that Medicaid is going to cover this care, and absolutely Medicare should cover this. I agree with those folks that Medicare should be covering dental, and hopefully this expansion will represent expansion in other programs as well.
Belkis Garcia is a staff attorney with the Legal Aid Society, again, the group that filed this lawsuit that has resulted in this very significant settlement that they're announcing today. Thanks so much for your time and helping us better understand what this means.
Thank you so much for having me.